Okay, good morning, everyone. Thank you all for joining this morning. You should have just received notification that the meeting will be recorded, and I'm doing that because we have a presentation today, and so I want to make sure the folks that aren't able to join us this morning can have access to that, and I'll share it out with everyone as well, and so that is the reason for today's meeting being recorded. So let's go ahead and get started. I'm sharing the agenda with you here, just so you guys can see what we have planned for this morning. I have just a few, not necessarily program updates, but some reminders that I'm sure you all are aware of at this point. And so I just wanted to talk a little bit about these things before I hand it over to Emily for our presentation today. So first things first is that we are entering into our summer months. And so I know almost all of you do this already, but as a friendly reminder, we just ask that you continue to send those Handle with Care notifications throughout those summer months and collect that. I know they aren't necessarily going anywhere since kids won't be in school, but we like to do that as a best practice to keep those law enforcement and emergency services partners in the practice of sending those notifications, just so they can have that and they don't have to worry about stopping and starting. And so if you need to have discussions with your teams on those Handle with Care notices being sent during the summer, please do so. I'm also happy to join those conversations if you need. That's first. And then second is, since we are coming into summer, I just wanted to give the opportunity for anyone to request additional training that might be needed. I know basically everyone on this call is, trained. You all know what Handle with Care is. You can communicate that to your teams, and that's great. But if for any reason you would like me to come and provide a training, whether it be virtual or in person, I am happy to do that. So please reach out to me if you would like to schedule something before the start of the next school year, since we do have these summer months to kind of get some things done before kids come back to school. Okay. Let's see, what else do I have? Also, kind of along the same lines of training, I would just, and tying in our summer months, I would just like to pose to the group to maybe use summer to start thinking about program expansion if you fall into that category, where all of your partners aren't necessarily participating in Handle with Care just yet. That could be including other partner agencies, other law enforcement agencies if you're in some of our bigger counties. I am also happy to start facilitating those conversations or having a brainstorm session with any of you to kind of see what that looks like in your particular county. But I would challenge the counties that have kind of been operating Handle with Care for quite some time now to think about ways we can maybe expand or improve the program, get some creative thinking in there. And so I am always open to having those conversations as well. Does anyone have any questions about anything that I've covered so far? Okay. Not seeing anyone. You can feel free to take yourself off mute, use the chat. That's totally fine. The last kind of bit of admin that I wanted to share with everyone is my office did just post for a job announcement, and I will show that link with you here. It's for an administrative specialist. I will share this link out with everyone. I can throw it in the chat as well. But if you or someone you know would be interested or you want to share this with your networks, please do so. So I will hand this link out to everyone in the chat, and I'll send it in a follow-up. So just to give you guys that. All right, so that is all that I have for program updates and talking points. And so I am going to throw it over to Emily so she can introduce herself, and she will share her slides. So Emily, it is all you.
Awesome. Thank you, Kelly. Hi, everyone. Good morning. My name is Emily Armington. I'm the Local Management Board Director here in Cecil County. I work in Cecil County government through the Department of Community Services, and our local management board funds numerous projects every year. And so I just wanted to share one of those projects with you through the Prevention Overdose Response Team. I had reached out to Kelly a couple weeks ago to share some of her updates, and she's like, I think this group would really like to hear this. So I'm going to share my screen. Let's see. Okay, can you guys see that? Awesome, thank you. So the Cecil County Prevention and Overdose Response Team is a multidisciplinary team that reviews fatal and non-fatal overdoses here in Cecil County. And they provide an emergent response to not only the overdose victim to get them connected to resources, but to their family members. So the team will make connections and referrals, but one of the primary goals and initiatives of this is to prevent the generational substance use and generational trauma associated with SUD. So the Prevention and Overdose Response Team, also known as PORT, meets monthly and includes members of law enforcement, the Department of Emergency Services, local behavioral health providers, Cecil County Public Schools. John Roush is here today with us and participates in our PORT meetings, and several other agencies and organizations in our community. So in those monthly meetings, CCPS was reporting the Handle with Care numbers. And so going back probably about 18 months ago now, we had very, very low numbers. Some months had no Handle with Care notifications whatsoever. So that was identified through the Prevention and Overdose Response Team as one of the areas that our community really needed to make some improvements on. So our goal was really kind of two-pronged. So we really wanted to make Handle with Care easier for law enforcement, first responders to make those notifications. And then we really wanted to publish materials and visuals that would act as a reminder to doing those Handle with Care notifications. So talking with some of our law enforcement partners, there was no kind of checkbox process that if they filled out a report, it would get kicked back if they didn't do this. There wasn't any of that. So we wanted to make it, make something visual that was serving as a reminder for folks. So we worked with our county IT department to create a desktop background and got feedback from law enforcement to change some of this language. So this is what you're seeing right now. This was actually remotely added to the patrol computers. So every patrol deputy through the Cecil County Sheriff's Office has this as their background screen. So whatever was there before, just one day it was changed over and this was kind of in their face. So we did change some of the language and the definitions and really wanted to provide them with good examples of when they should be doing a Handle with Care notification. So send a notification when a child is present for domestic violence, assault, shooting, eviction, fatal and non-fatal overdose, search warrant, serious injury or accident, or any other traumatic situations. So the sheriff's office was able to identify a patrol group for us to act as a pilot. And we created a desktop background that was added to their patrol cars, and then also an icon. So I'm going to scroll down here. So in addition to the background, everyone has this little icon, which actually is the Handle with Care logo instead of this yellow icon here. And so when officers click on that, it brings them to a fillable form. So we tackled number one, which was to make something visual as a reminder. Number two was to make it easier, because we're hearing from Cecil County Public Schools that sometimes when a notification was made, it just had an address or just the kid's name and not the address and not the date of birth. So they were kind of having to do some detective work. So we really wanted to make sure we had a list of what was needed for these notifications. A lot of times the school district can figure out one way or another, but just to make it easier and make sure officers and first responders knew what was needed for these, we created this fillable form. So they click on the icon. Again, our little definition comes up here. Kiddo's name, address, date of birth, who's reporting it, because I think that that's important that we can, start tracking where these are coming from. And then when you click additional children, when you click yes, it will populate other fields if there are other kiddos in the home. So as easy as that, click submit, and then it goes right off to the school district. We did a lot of back and forth with our IT department about how to do this and what was going to be the easiest way. They had some protective fields on there. You all know the pictures where it's like click a palm, any picture that has a palm tree or a stoplight. we were like, take that off. Like, we want people to easily be able to do this, and not have to at 3 a.m. find a palm tree to be able to submit a handle with care notification. So we were like, don't do that. So we went through a pretty decent process of how to make this as simple as possible, but also how to collect all of the information that was needed. So the pilot group went really well. We were able to roll it out to all of the patrol groups within a month, all of the school resource officers, as well as all of the detectives in the sheriff's office. So our prevention overdose response team coordinator actually works out of the Department of Emergency Services. So in addition to doing this at the sheriff's office, we were able to add this to paramedic computers in ambulances as well. Obviously, county IT couldn't set up other jurisdictions like Elkton Police Department, Northeast, state police, all of that. So we did come up with these little 5x7 postcards that we had printed just on Vistaprint. I think we got 300 of them or whatever, had those printed up and distributed these to those other agencies that we, couldn't control their IT. We also heard about some Handle with Care initiatives through Charles County, and we were able to purchase these adorable little teddy bears. They have the Handle with Care logo on the shirt there, and then so we have these with our ambulance crews in the county, as well as patrol cars through one of our agencies. So Elkton PD has about 100 of these, and we put them in Ziploc baggies to make sure they stay clean when they're in patrol cars. And really the whole point of this is to provide a connection with first responders and youth who are in crisis, and to provide them comfort during a stressful situation. And then our second hope in doing this is to, when the first responder gives this to a kid, that will kind of serve as a reminder that when they get back in their vehicle, they need to complete that notification. So that was actually just rolled out probably about 2 months ago. Also from Charles County, I want to give them the credit here. We were able to purchase these challenge coins, which are really big with first responders. And so this is really an appreciation for making these notifications. Elkton Police Department recently presented these to officers at their awards banquet. John Roush has his right there. I have mine right here on my desk. And these have gone really well for that pilot patrol group that really tested the fillable form for us. So we really just wanted to show our appreciation with all of the work that they were doing. And so right now we are busy prepping for our summer months. Like Kelly mentioned earlier, it's really important to continue this through the summer months. We know our schools have a lot of connections with our kiddos for extended school year or camps, or, just gearing up for the fall. And they really need to be in the know about what's happening, over the summer. So we came out with another postcard. So again, these are just a 5x7 on kind of heavy duty cardstock, glossy paper, and pass these out to some of our folks. We also had this, we still Handle with Care, printed up in a large poster. And it will just peel right off and stick to like a door or whatever. So we've got a couple of those over at the Sheriff's Office and the Department of Emergency Services. And then I wanted to share with you our numbers. So again, we were reporting back in February of 21, we had no notifications at all. And then we were starting to see an increase when we were having these conversations with law enforcement. We actually rolled out the link and the desktop background here in October of 21. And we've just seen an increase ever since. So again, just kind of wanted to share some of our successes here in Cecil County. They seem to have been a big hit. It's really working. I know John will say he sometimes is getting multiple notifications for the same kid, but we're like, we'd rather receive multiple than none at all. And so these are not duplicative numbers here. This is, just one referral. But we've really seen some great success. And I think it's just really a result of our prevention overdose response team identifying this as a need. Again, making it easy for law enforcement and then providing that visual as a reminder is really, really important. So thanks to John for all of his work and dedication on this project. It's been well worth it, and hopefully we can keep it going through the summer months and into the fall. So I'm definitely open to take any questions, and I know I see some comments here about the challenge coins. I can definitely send you information about that. I think Kelly's going to share these slides afterwards if you'd like to use them as a reference, and I'll leave my email in the chat as well if anyone would like to connect later. Thank you.
Thank you so much, Emily. Does anyone have any questions? Pilar, go ahead.
Oh, this is awesome. Congratulations on this process, on setting up this process. I'm curious about, so it sounds like, I just want to make sure I understood exactly how it works. The web form and the database live on your county server. Is that what you described?
So, yeah, so the all of our county IT, obviously for my department, the sheriff's office, and the Department of Emergency Services, we're all tied in to the same department or same IT. They just created a fillable form on the website, which links to the icon. And then it really just shows up on John's desk as an email. So then it populates, the form populates as an email.
Okay.
We have our local police agencies that are now also picking up on the use of that form, and it does come in as an email directly to me and Todd Creek, who's with the sheriff's office, and another person in my office, and we push those notifications out to schools as a result. And I can't thank Emily enough for her, we'll call it a vision to expand this, and she's gotten the right people involved. The port coordinator, the overdose and heroin coordinator, and all the police agencies now are responding. So hats off to her for making this happen. That's really the impetus here.
Thanks, John.
That's so great. So I noticed so are you collecting the school information as well, or?
So we'll get feedback from John. So these monthly prevention overdose response teams, they'll share the numbers with us. The school district really would be responsible for collecting, the agency where it's coming from. I know Elkton PD requested all of the officer names so that they could be recognized at their banquet. So it kind of transitions at that point. We're kind of the front end of making sure the notification is out there, and then the school district is really responsible for collecting the backside of it, if that makes sense.
Okay, yeah.
That's all data that we submit to Kelly anyway, so
Yeah.
it's easy to reproduce that and send it out to whoever needs it.
So I guess I was curious about so the first responders are not collecting the name of the schools that the kids are going. They're just, what you're collecting is just the information that we saw on that first page.
Yeah. So we want to make it as easy as possible for law enforcement. So we're basically asking them for information that they would already be collecting on the scene of an incident or one of those examples. So name and date of birth is pretty common, and then obviously the address that they're responding to. If it's like an ambulance crew that's responding to something that's not at the home, they really want to make sure they collect the information of the address of the family, their home address, not the address where they are responding to.
Pilar,
you're collecting home address too? I'm sorry, I missed that.
Yeah.
I can also shed some light, because I know many of you are not collecting the address, and that's totally fine, because a lot of you do collect that school on the front end, so you can track exactly where that notice needs to go. Or if you have one of those systems where it goes directly to the individual school, you obviously need that information on the front hand. And then a lot of the times we ask for the first responders to get the school if we have kids with multiple names, to take out any work from that middleman. And so this is just one of those examples of how counties kind of make it a little bit different for each of their own systems to see what works best. So if you are one of those counties that does collect the school. Please keep doing that. And if it's working for you, that's great. No one's in the wrong here. So I just wanted to clarify that this is definitely one of those situations where you're customizing it to your county and what works best and what you're able to do.
Yeah, no, that's I think it's awesome what you're doing. I was just curious about some of those details. So we have an automated system also. So
awesome.
And it really does make it a lot easier. So anyway, I'd recommend it for sure. Thank you.
Any other
And
questions?
I see, oh, go ahead. Any other questions? I see that everyone is interested in teddy bears and coins, so I'll be sure to get that information out to you all as well, because we've now heard from 2 counties that have really benefited from those things, so that's really exciting. Okay, so let's see, where are we? I think we are ready to kind of move on to some county updates if there are no other questions for Emily. Not hearing or seeing anyone. So Emily, thank you so much for that. I will be sharing the images and slides that she showed with everyone and along with this recording. So feel free to hang out and listen to all the updates, or if you have to go, that's totally fine, but you are welcome. And
I'm actually going to jump back to my local care team meeting, but I'm going to leave my email in the chat. Thank you all.
Thank you. Okay, so to make this easy, I'm just going to go across my screen to call on you all for updates. And so if you are new to this call, because I am seeing some few faces who I haven't seen before, or people who we haven't seen in a while. So when I call on you, please just introduce yourself, say what county you're representing, what agency or department you're in, and then provide us with that quick kind of update on what your county is doing for Handle with Care, if you have one. If you don't have an update, that's fine as well. And so I'm just going to go across my screen, and the first person I see is John, and that you just had a very great update from Emily. So if there's anything else you'd like to add,
Yeah,
but please introduce yourself.
The only thing I'll add, Kelly, is so far in May, we've had 20 notices impacting 30 kids. So, you know, we're seeing numbers like you know, we have seen or impacted 30 kids in January, 20 in February, 34 in March, 18 in April, 30 in May. So things have dramatically increased as a result of the efforts here. And the benefit comes with being able to reach kids and families. So we're happy with where we are right now. But, you know, I think we can still reach a lot more, but we'll get there.
Yeah, it's been really great to see. So I'm so happy that it's been so successful for you guys. Okay, next I have Kelly.
Good morning, everyone. We've had quite an interesting April.
Kelly, can you introduce yourself really quickly just so everyone knows what county you're from?
Sure. Kelly Morris Springsteen, out of Wycomico County. Hope everyone can hear me. Backing up, it's been quite busy. February, we were tiptoeing around 17 students that were affected in some manner or the other. And then we marched into March with 11. And then we picked up in April with 16 students. We actually had 2 parental deaths, and that was with accidents that affected some of our students. We also lost 2 students in the month of April, which affected one of our larger elementary schools as well as middle. And right now we're holding on, but April was quite busy for us. The 2 accidents that occurred, they occurred within a 2-day period. So it was back to back. So quite busy for our mental health staff going into the schools and supporting those schools. But we made out pretty good, and they were in both of those buildings for a period of time to help support the staff and students. So we've been quite busy on the shore. in the last couple of months here.
Okay, thank you. And I have Rashida.
Hello, everyone. I'm Rashida Harold Brockington. I'm the Handle with Care Coordinator and Missing Youth Advocate with Center for Hope in Baltimore City. So our update is that we are pretty much starting over. Once more, our challenge in the city is that given our dynamic, that we are a child advocacy center and we are really not co-located with government, it has been difficult to kind of, bridge the gap to have this be a sustainable program. So we have started completely from scratch with our steering committee, and starting with engaging the mayor's office, our health department. We are now a part of the trauma-informed task force for Baltimore City, as well as the Baltimore Children's Cabinet, and those folks that are directly in line with the mayor's office. They have representatives with BPD that can get us that back in channel. I think that our challenge for the most part with BPD has been the pushback on how much we see in the city, how much trauma we see in the city, and they're so overwhelmed that they can't see how this how policies align. So our huge project this quarter has been working on helping them see how the policies align, and making it as easy as possible for them to make those notifications. We've also started a pilot program at our Child Advocacy Center with our family advocates and our forensic interviewers, and also the police officers that we do have co-located with us there, the Family Crimes Office, Missing Youth, as well as the Child Abuse Office unit is all co-located with us. So we have been working closely to do a referral system that way, and also a self-referral system for our families that come through our center. We found that sometimes when our family advocates are suggesting the program, when they are explaining the program, families are at such a heightened alert because they're in for a particular trauma, that they can't kind of just see the forest for the trees for us to make that notification. So sending them home with, a whole packet, a QR code, whole nine, that they can refer themselves to the Handle with Care program has seemed to be working a bit. So we'll see. We'll keep our eye on it, and we will definitely see. But all of the updates that I've heard from you all thus far has been great. I have my notes, so hopefully we'll be able to pick up once we have a little bit more buy-in from community.
Thank you. I have Kirk.
Sorry about that. I had to find the mute button. We've struggled very similar to what Ms. Harrell just described with many of our local agencies. With Kelly's help earlier this year, we tried to do a retrain, a refresher. We invited both the EMT and fire department, as well as all local law enforcement agencies. We're still not getting as much formal communications. I really do like that self-referral idea as well. That's something that we'll expand, as well as some of the challenge initiatives that were put on there. So I'm also going to be attending the NASBRO conference this summer in July, and they've got a breakout session on something similar to Handle with Care. So I'm hoping to come back to some additional ideas from that.
Thank you. I will just say before I continue, because it seems that a lot of you are interested in this self-referral process, please don't implement any self-referral until you have talked with me and checked things out with me, just so we can make sure that we're keeping things to our model and things like that. But so if that is something that you are interested in implementing in your county, just touch base with me and we can get that going. Okay, I have Pilar.
Hi, Pilar Olivo. I'm the ACEs liaison in Frederick County with the Frederick County Office for Children and Families. We have as I alluded to before, we do have an automated system. Our links are on the mobile data terminals of all our first responders in Frederick County, and we've had our primary participation though really comes from our city police department and our sheriff's office. We do have other municipalities that participate, but at a much reduced. They're smaller, first of all, but then they do participate at a much lower level, much more intermittently. So we did hit a high in March of 85 notices sent for children, and it's in April. It was also quite high. So let's see, April was 66. So we are seeing, and I'm not hearing from the first responders about like what's the cause for, is it, I'm not hearing anything specific, like there's a specific law enforcement event, something that was a specific investigation that uncovered. I'm not hearing about anything like that. This is, I think, a combination of really strong participation from our city police department. They've have a whole host of new supervisors that are very committed to the project. We have a new chief who's been in the job for about a year. He's very committed to the project. And so I think it's primarily just kind of organizational commitment. It's been a general order. Submitting a handle of care notice has been a general order, part of the general order since we began in 2019. So, but this is, we're seeing just a lot of strong participation. I think there are, the schools have told me that they are seeing a lot of mental health concerns, rising incidents from children. And so that's another component of this. So thank you.
All right. Thank you so much. I have William.
Hey there. Hey there, everybody. I'm Bill Allen. I'm Supervisor of Pupil Services for Caroline County Schools. We have had, it's been very slow here, and I hope it's because there has not been anything going on, but I don't necessarily think that's the case. We've had 2 reports for April and 3 so far in May. Now, looking at the data, this has come from various agencies. I can't say that it's just coming from the Caroline County Sheriff's Department, but there's some from here, one from there, one from there, one from this municipality. So the word is out, but I just don't know that our numbers are very high, and I don't really know the reason. And like I said, I'd like to think that it's because there are no children out there that are experiencing any trauma. But if they are and we don't know about it, we certainly need to do something about that. So Emily's presentation was very inspiring today. Perhaps we need to look at something like that just as a reminder. But that's where we are here in Caroline County.
Great, thank you. I have Lauren.
Hi, good morning, everyone. I'm Lauren Williams from Worcester County in our Office of Student Services, and we are in our first year implementing Handle with Care, and we had a big kickoff in August, and we are having a lot of the same challenges that I'm hearing from others, just continuing to keep this program front of mind for people. That we have had 2 meetings of our stakeholders, and at the last meeting our law enforcement leaders generated a lot of ideas that they thought would help with those that are out on the road. So we are working on, similar to what Emily presented, some posters, some visuals. That background idea is a really wonderful desktop background idea. Is a really wonderful idea that I might try to see if they are interested in. I think summer is going to be really difficult for us because of being a resort town. It's going to be really hard. The assumption is, that they're not from around here, so they're not gonna, probably take that extra step with the notification to the local school system. But we, we'll regroup in August if that does happen, of course. And I think that's all I have. Thank you.
Thank you. I have Kathy next.
Good morning, everyone. I'm Kathy Kiesling, Director of Student Services for Charles County Public Schools. Thanks for the shout out, Emily. I know she's still not on here, but I really appreciate that. We are still utilizing all of those strategies, and it has really not increased our numbers these past couple months. And I think it's because we're still getting buy-in from our sheriff's department, but some of our other emergency responders were just still working to get them on board. The other thing that we do on top of the teddy bears and the challenge coins is we also recognize the officers that do submit a handle with care. We have an automated system as well, but we provide each officer with a certificate of appreciation. So it's just a little extra step so each officer feels appreciated for doing what we have asked. Basically, they know is the right thing, and it does help. They very much appreciate all of those things. Our numbers are not real high right now. Again, I know it's probably not because they're not the situations, but we're just not getting some of our other responders to buy in. So that's always an issue with us. But our sheriff's department has done a really nice job of being those advocates for us. So we really do appreciate them. That's about it for Charles County.
Thank you so much. Next, I have Tamika, and it's so good to see you.
Hi, guys. I'm Tamika Perkins. I'm the Director of Youth and Victim Engagement with the Anne Arundel County Police Department. I apologize for not being around, but I am back. We have not been focusing on expansion. We've been focusing on maintaining in March. And I'll say April was a little bit less, but May's on target. In March, we had 155 notices. And that is pretty much consistent with what we do during the school year. I anticipate that given some kind of changes and things that we have going on in the county, we will get a lot more this summer as it gets warmer. And so we're going to work with the school system and our crisis intervention team to see how we can accommodate those youth similar to how we did during COVID, I would anticipate. We are getting ready to go back and do a full, our yearly roll call training for all 800 officers between Annapolis City and Anne Arundel County. That will be occurring in June and July, and that is because of some other legislation that's going on, but we'll include Handle with Care in that, and then we'll go ahead and hit it hard in September, October again as well. So typically we only do, one training, but just because of the nature of what's going on, they'll be getting it twice. We, just because there's so many new people on the call, is we do business cards as reminders, and they will get a copy of the business card with the text or the email to the Handle with Care line at every roll call training. So they lose them, but most of the officers will tuck them right in their visor. We just rolled out a new reporting system as a police department, and in it is a actual checkbox that says Handle with Care. Now that does not automatically trigger it, and we do that because we intentionally made it not trigger it so that for confidentiality, because it's linked with the police report. However, it is a reminder to the officers that I should be sending one. And then just for those of you who don't know, the way that we have it set up is I'm a civilian within the police department. However, I man all of the handle with cares for both our agency, Annapolis City Police Department, and Roanoke County Sheriff's, and the state's attorney, Office of the State's Attorney. And they can send it to a text line or an email address at the beginning of every morning. At the beginning of every morning, I pull those names and date of birth. The school system has allowed me limited access to determine what schools each child goes to, and then we forward those directly to each principal and school resource officer. It is, I think that's a good way of doing it for larger counties so that if you can navigate it. But as we increase the number, making sure that there is not a single point of failure is essential. Like I said, we're getting ready to go out and do training. We do reference handle with care in all of our crisis intervention training to go more in depth as to why. And I think that's been a huge part of the increase in notices. We know that there are a couple other law enforcement agencies primarily going out to corrections and the sheriffs so that we can get on evictions and things like that. But it's just a manpower thing right now. We're a very small unit that handle with care is a very, very small piece of what we do. And the training is very intensive, but it's effective. Because law enforcement is used to getting a lot of mandates where they are never told why. And so I think the training and the reminder training is essential. They will now get handled with care training all the way from the academy through in-service through refresher training. And we're going to make sure we're going to work with the school system. I see Ryan's on here to make sure that we get our admin trained too as we get new admin as well. So thank you guys.
Thank you, Tamika. That's great. I have shared your business card with so many people, even out of the state of Maryland, as an example. So I'm sure I have shared that with almost everyone on this call. But if you would like to see that, see it again, let me know. I have like a saved photo of that business card that I like to share with everyone. So thank you.
We are looking at the possibility of switching from an either or. So right now you can either text or email. And we are looking at the possibility of making that an email only or a form only. And so we're going to discuss that idea with this next roll call training. I anticipate that we're going to get a significant portion of pushback from the officers on that. And it's one of those things where as long as they're sending the notices, if that's just a minor inconvenience that I have to take, then that's fine. I will say that my younger officers are preferring email. My old school officers want to do a cell phone. And so that's something that we're going to revisit as people move on in their careers or retire.
Thank you. I'm sure that will be really interesting for us to kind of see what goes on as you continue to do that. Next, I have Matt.
Good morning, Matt Evans, Supervisor of Student Services, Queen Anne's County Public Schools. Looking at our data, and I've known this, all of our notifications come from the Sheriff's Office and Emergency Services, and they're still diligent about that, which is good. I will say we're we have half the notifications as we did last year. Last year we were averaging about 4 a month. This year, about 2 a month. Again, and we've had recent ones from both of those agencies, but I do think we should look into kind of a reboot. There's a new chief of police in our one municipality that has a police department, which is only Centerville. Otherwise, it would be the sheriff's office. And then I heard somebody mention the fire department. I want to pull them in as well. So we're happy that our sheriff's office and emergency services are both very, very diligent in providing us these notifications, but certainly want to reach out and include the local law enforcement as well as fire departments.
Thank you. I have Robert.
Yeah, hi everyone. Rob Schmidt, the mental health coordinator for Tulba County Public Schools. And looking at Emily's slides was, I guess, inspiring with the data collection and comparing the number of, notifications with, those that were impacted within the schools. Really is hopefully someplace that Tulba County schools can go and collecting data beginning in the new year as of July 1st. We do work closely though with our 5 law enforcement jurisdictions in Talbot County. And we do get pretty good notifications. However, we're not collecting the data as probably accurately reported, since it's reported to several people within the county. So we definitely need to refine that. For example, this past weekend, we had sadly a suicide, and we were notified of the siblings involved in our district. So we had supports in place awaiting if they were to be in school, if they were going to be in school, communication to the family. So, we do get calls throughout, and that was from several different jurisdictions that work jointly together with this notification. So, we are getting the information in. However, it's not channeled to a specific person to collect the data. And I agree that, seeing the data on that slide that that Emily had presented this morning, it really, I love seeing the charts and the data and the pie charts. And so we definitely need to work on that over the next month and a half to get ready for next school year. So that's where we are. That's probably our weaknesses. We are getting it, but we're not displaying it or sending that information in.
Thank you. I have Anthony.
Hello, can you hear me? Good morning. Anthony Rumgay, Allegheny County Board of Education School Safety Supervisor. Forgive me for not being on my camera. It's not working. I got a new one and it still doesn't work. We had a pretty routine last few months. I am a retired police officer, so I appreciate some of the things that you guys are saying about law enforcement. Some of these are being kind. On my end, how it's working is when I call their administrators for our local agencies, it seems like the notifications go up, and when they don't hear from me, the notifications go down. So that's where we're at. Still working in progress, and really not much to report up here from Allegheny. Thank you.
Thank you. I have Brian. Brian, are you with us? Okay, not looking like it. We'll come back. And then I have Kyle.
Hi, everyone. Kyle Potter with Montgomery County Public Schools. We're in our pilot year. We have one police district in the Germantown, Up County area, which includes about 35 of our schools. We are having some serious buy-in issues from our law enforcement partners. We've received 8 notifications the entire year. I'm currently trying to get some information from MCPD on how we can make this better. We also had a tentative plan to expand it beyond just the one police district. And I can't seem to get any information on how or what they're thinking about that. So we're looking at other options at this point as far as other local municipal police departments and some other emergency responders that we can start to try and include for next year.
Great, thank you. Let me try Brian one more time. Okay, not hearing anything. I did leave out one update from the beginning that I would like to share with everyone. But first, thank you all for providing those updates. I know it's super helpful for you all to hear what's going on across the state. And it's great for me to see everything as well. And so I thank you all for taking time out today. I did want to say that I have started re-engaging with state police and getting them involved in Handle with Care as well. And so just putting that on everyone's radar. I know some of you involve MSP in your systems already, and that's great. And so we're looking at it from more of a top level approach. And so I just wanted to just give everyone that update that we are really, I'm having those conversations with MSP about how to get them involved and make that as easy as possible for them as well, since they are in all parts of the state, of course. And then let's see, what else do I have? I am conscious of our time. I don't have too much left. I just wanted to say, please make sure that you are filling out those monthly data reports to me so I can populate our dashboard. You all can use that dashboard to serve as your data visuals. Feel free to screenshot it, share it. It's public access on our Handle with Care website, but you won't be able to see any data unless you send it to me first. So just please make sure that you are filling out those monthly data reports, and you can do those retroactively. So you can submit for any month. And I think we have it starting in 2018. So anything there you can submit. And I think those are all my major updates. Does anyone have any questions about anything? Okay.
Hey, Kelly, it's Sandy.
Oh, yeah.
I'm Sandy Caldwell. I am the school safety analyst at the Maryland Center for School Safety. I do see a lot of faces and names that I recognize. So, and from being on the calls here as well. But I just wanted to say, if there's anything that we can do, if anyone's having struggles, if there's anything that we can do to kind of help either put you in touch with the right people or make those introductions or anything like that, please let us know. We're here to help. I am, while I follow current trends, that's one thing that I do, but I also manage the Safe Schools Maryland anonymous reporting system. I'm seeing all the information that comes through there as well. There is one thing that I just wanted to make everyone aware of, just a trend that we've seen across the state in kind of sprinkled across the state, is that I think it was April, we were seeing edibles that were, normally it's just marijuana in those. We were seeing those laced with other things as well. And kids were getting sick. So, if keep that on your radar. But again, if there's anything that we can do, we're here to help. Also, we are having a summer conference, July, I believe it's the 12th and 13th. It's on our website, and I'm going to put the link in the chat, but it is free, but it is in person this year. It's going to be held at I think it's called the Maritime Museum. It's in Anne Arundel County. Or that Maritime Training Center, I think is what it's called, in Anne Arundel County. And it's 2 days. We have some really good speakers. The emails are going out about that now. So one of those is drug trends, and I know that you get some information with that, with your Handle with Care notices. But like I said, if there's anything that we can do, if we can put you in touch with anyone or kind of help you make those connections to help your Handle with Care programs run more smoothly, please let us know.
Thank you so much. I didn't mean to skip you. You're the first box on my screen, and I usually close out with you, and I forgot to circle back. So thank you.
It's okay.
Okay, other than that, I think we are set for this morning. Thank you all so much for taking your time. I think this morning was really helpful. I will be following up with a lot of information about teddy bears, coins, the recording, slides. So be on the lookout from that for me. Sandy just popped that conference link in the chat. So if you're interested, click on that before I close out. But thank you all so much, and I hope you guys enjoy the rest of your day, your week. Hopefully you can relax during the summer, and I will see you all at our next call. So thank you.
Thank you.